Hello everyone, I am Dr. Madhadar and you are watching sqadia.com. Today our topic is slipped capital femoral epiphysis. What is slipped capital femoral epiphysis? In this lecture, we will be briefly discussing what exactly is epiphyseal slip, does actually the epiphysis slips or not, and we will briefly discussing over the pathophysiology as well. Then we're moving on towards what is the points of SCFE on history and examination, and what to look for and how to rule out certain diseases which are associated with SCFE, that is hypogonadism, hypopituitarism, hypothyroidism, and renal osteodystrophy. From then onwards, we're moving on towards the physical examination, when we will be knowing in details what to look for in a patient with on physical examination, what to see on first, and then how to actually palpate and elicit certain signs such as Trendelenburg sign, Brennan sign, Thomas test, and all these has to be performed to elicit certain pathology and get to the correct diagnosis. From then onwards, we'll be briefly discussing the imaging which may be required to confirm our diagnosis of SCFE. We'll be briefly discussing what is clean line and what is its importance. From then, we'll moving on towards the other signs such as the Kapner sign and what it actually tells us regarding SCFE, and how to actually assess the Kapner sign on a radiograph, especially the X-ray pelvis view AP joint. From then, we're moving on towards the calculation of Southwick angle. We'll be discussing in details actually that how to calculate the epiphyseal line, epiphyseal axis, then how to calculate the proximal femoral axis, and then how to calculate the angle. And what is the importance of calculating angle on the uninvolved limb as well, and how to actually assess when you are calculating the angles on the both sides, and what if both sides involved, then how you have to calculate it. If only one side is involved, then how you have to calculate it as well. Then we'll be moving on from, after assessing it, we'll be going on towards the classification of all the temporal, clinical, Southwick, radiographic, as well as grading of the SCFE. Once we have done that, then we will moving on towards the treatment options in the case of SCFE. The most common and the most go-to option is always in-situ pinning. We will briefly discussing when we go for bilateral in-situ pinning fixation, that is the prophylactic fixation of the opposite hip, and do we really need to go for it or not. From then, we will moving on towards other options regarding if we are not going for in-situ pinning, then what are the other options. For example, we will briefly discussing open reduction of the hip joint or the Ganz technique. In Ganz technique, we'll be discussing in detail that what is actually the surgical dislocation of hip and how we actually reduce the head back in place, and what are the options of hardware which we can be used in the case of the slipped capital femoral epiphysis. From then onwards, we'll be moving on to other osteotomies which can be done in the case of the SCFE. We will be briefly discussing what is modified Dunn procedure and Dunn osteotomy, and how to go about this in details. From then onwards, we will be discussing the Kramer osteotomies. As I told you, the osteotomy can be done at the level of femoral neck, at the neck and trochanteric junction. That is, the Kramer is usually done at this level, or we can go for certain other osteotomies which are below the level of trochanter or at the level of trochanter as well. And coming to those osteotomies which can be done below the level of trochanter include the Southwick osteotomy to correct the deformity of the proximal femur, and usually these are the valgus derotation osteotomies. Then from that onward, we'll moving on towards what are the role of late osteotomies. What are the different osteotomies which can be done at the level of acetabulum to correct the acetabular retroversion, and then how to go about for when we are doing osteotomy of the acetabulum, and how to fix the proximal femur as well. If you want to watch a complete lecture, go to www.sqadia.com and you can have whole of the lecture over there. Similarly, if you want to watch other lectures associated with orthopedics, there are a plethora of lectures available over there. You can go to sqadia.com and you can have lots and lots of online lectures regarding the medical education. Thank you very much. Keep watching sqadia.com.